When should I be concerned if the bleeding doesn't stop or if it's heavy?
Hello, and welcome to this important discussion. We will be talking about an issue that many people have encountered at one point or another: heavy or non-stop bleeding. The body's ability to stop bleeding is vital to our health, but sometimes this process doesn't work as it should. So, when should you be concerned about heavy bleeding or if the bleeding doesn't stop? Let's dive in and discuss this critical topic. Recognizing serious bleeding is crucial as it can lead to severe complications if not properly addressed.
What is normal bleeding?
First, it's essential to understand what constitutes normal bleeding. This can depend on the specific situation, such as a minor cut or nosebleed. Typically, with minor wounds, bleeding should begin to slow within a few minutes and stop completely within 15 to 20 minutes when appropriately managed with pressure and elevation. For women during their menstrual cycle, heavy bleeding, known as menorrhagia, is generally defined as losing 80 milliliters or more in each period, having periods that last longer than 7 days, or both.
When to worry about non-stop bleeding?
Now, let's consider when you should be concerned about bleeding that doesn't stop. If a wound continues to bleed heavily after 15 to 20 minutes of applying direct pressure and elevation, this is a cause for concern. Likewise, if blood is spurting or pooling, or if the wound is large or deep, you should seek immediate medical attention. Remember, the persistence of bleeding could be a sign of a more serious underlying condition.
When to worry about heavy bleeding?
Heavy bleeding, whether from a wound or in the context of a menstrual cycle, is also a potential cause for concern. For wounds, heavy bleeding means blood is flowing freely and quickly. In terms of menstruation, if you're soaking through one or more sanitary pads or tampons every hour for several hours in a row, or if you need to use double sanitary protection, it's time to seek medical help. Moreover, if you're experiencing severe pain or symptoms of anemia, like fatigue or shortness of breath, it's a signal that the bleeding could be unusually heavy.
What are the possible consequences?
Heavy or non-stop bleeding can lead to various health complications, from minor to severe. Some of the complications might include anemia, shock, or even death in extreme cases. Therefore, prompt medical attention is essential whenever there's heavy or non-stop bleeding. In conclusion, understanding when to be concerned about heavy or non-stop bleeding is crucial for your health and well-being. Remember, the key is to be vigilant about the duration and volume of the bleeding. It's always better to seek medical help when you're unsure. Thanks for watching, and remember, stay safe and stay informed.